Hello, this is Ivy. This is a public service health announcement for travelers going to areas that have rampant cholera infection. Please listen and take note. If you are an international traveler, watch for these. This video will elaborate on the agent responsible for cholera, signs and symptoms to watch out for, treatment that you can seek, and diagnosis of cholera. Relationship between the water supply and cholera, and the public health and efforts to reduce illness in developing countries. If you are about to travel to any international country, please, this is very important health announcement. Listen and take note. We are so glad and happy and fortunate that those of us in the United States, we have CDC that recommends that all adults traveling to areas with active cholera transmission should get vaccinated. My question to you is that, are you vaccinated? If not, you need to get it. Cholera is a very dangerous disease and is caused by the bacterium that is called Vibrio cholerae, and if not treated, it can lead to death of the one that get the disease. It does not take time for you to die. If you get that disease, it takes a few hours. Houseflies are recognized as carriers of easily communicable diseases such as cholera. What do? They go and sit on feces that are out there, and then with their wings and heads and mouth, they come and sit on your food and spread the germs that they have touched from the feces onto your food. And if you consume without warming or washing, then you get infected. Some people eat food that are open to air for a long time without warming it, and some other also eat food without washing their hands before they eat. Please, as you watch this video, take note of it, because cholera is a very dangerous intestinal infection, and it's, as I said earlier, it is caused by eating food or water that is contaminated with the bacterium Vibrio cholerae. Cholera epidemic exists in Latin America, India, Middle East, Asia, Sub-Saharan Africa, and some cases of imported cholera have been reported in the United States for the people who have recently traveled outside of the country. Those are the areas that are very rampant with cholera. So please, if you're about to travel to Latin America, India, Africa, the developing countries, you need to really watch out and learn and get yourself prepared to be able to not to get to prevent cholera infection. This picture shows cholera epidemic areas, and this is just a recent 2 years or 3 years ago. Yes, in the developing countries, these are some of the areas that they get their drinking water from. So if you travel to a developing country and you do not have bottled water. Please, before you drink any water, or if you are going to stay there for days and weeks and months, make sure that every water that comes your way that is not is a water that is not preserved or not treated with chlorine, please make sure that you boil it well, let it sit covered and cool before you drink it. Please do not drink water that is being provided to you by the natives, because they are used to it, and your system will not be used to it if you are traveling there with for few days or weeks. Please. Most people do not experience symptoms of the disease when infected, but look out for diarrhea, abdominal cramps, a headache, nausea, and vomiting. I always say that watch out for the two P's, puking and pooping, because this is what cholera does. You will be puking at the same time and pooping, and it's not comfortable, it's not easy at all. There is this package that if you have it, is very good for you to carry with you in an area that is epidemic with cholera. Please have ORS with you, oral rehydration solution, very good in replenishing fluid into your system. If you have a baby and your baby ease or poop on himself or herself, and you clean the baby, make sure that you wash your hands very well with soap and clean water before you eat, please. And then if after using the toilet or latrine, make sure you wash your hands very well before you touch food or eat. Using and drinking safe water is very recommended, but I just want to warn travelers who are going to developing countries. Watch out for the water they provide you. Even if it's sealed bottled water, make sure it's really sealed before you drink it, because some of the people over there, they collect the use bottles and then refill them with their water that they drink and resell. Please watch out for that. And also, if you use your kitchen utensils, make sure that you wash them with soap and water and dry them and put them in a dry place. Latrines or toilets should be used. Fecal material can also be buried deep in the ground, but it should never be disposed of in places near water sources. If you want to ease, if you feel like puking or pooping, please go far from water source. Food that can be eaten should be hot, warmed, and covered, and also fruits need to be peeled off. I traveled to Africa years ago, and I was told by the public health nurses here that when I go to Africa, I should not think that because I'm from Africa, my system can take anything. I should be very careful. And so I'm telling you, maybe you are from Africa and you are traveling, make sure that when you go, you do not just get up and drink the water they provide you. Drink safe water. Make sure that the food they give you is hot, and also fruit that you can eat over there is orange and banana. Apple can be peeled, but you know the apple skin is as light and the germs can pass through. Finally, cholera is a very dangerous disease that should be handled immediately when it is suspected. Please see a doctor or a nurse. And also, as a traveler, make sure that you have ORS in your pocket or in your bag, or to help yourself and to help others. Stay healthy, safe travel. God bless you.